everyone. A big thank you to my colleague, Dr. Paul Mason, for inviting me to speak to you about the critically important topic of brain metabolism and mental health. My name is Dr. Georgia Eid. I'm a Harvard-trained psychiatrist practicing in Western Massachusetts in the United States. I've been using low carbohydrate and ketogenic diets, as well as other personalized dietary interventions in my clinical work with patients for more than a decade now. If you're personally struggling with any kind of mental health concern, I'm going to explain in this presentation how modern diets, even those we're taught to think of as healthy, such as vegan diets and Mediterranean diets, can actually jeopardize brain health and contribute potentially to problems with mood, concentration, and memory. So I'll suggest some specific changes you can make to your diet that can help your brain function at its personal best, and which may also reduce your need for psychiatric medication. If you're a fellow clinician interested in learning how to safely incorporate ketogenic metabolic principles into your care of people with psychiatric conditions, I teach a virtual course for practitioners of all backgrounds that you can learn more about on my website, diagnosisdiet.com/training. The global burden of psychiatric illness is growing, while access to professional mental health services remains extremely limited in most areas of the world. What if we could empower people to reduce their own symptoms using simple dietary strategies? What if there were a way to prevent many psychiatric conditions from developing in the first place? Then more people would be able to reach their full potential. We would reduce the need for psychiatric medications and other scarce mental health services, and the world would be a happier and healthier place. So yes, it is absolutely the case that medications do ease suffering for some people. But I believe the most powerful way to fundamentally change brain chemistry is through food, because that's where brain chemicals come from in the first place. The question is, which dietary changes are most worth making and why? And unfortunately, there's no consensus answer to this question. Most of us have been feeding our brains improperly our entire lives. So we don't have any idea what our true personal best is until we begin eating right. And of course, poor nutrition is not the only cause of mental health problems, but it stands to reason that the brain will develop best, function best, and be most resilient in the face of adversity and stress if we feed it a brain-healthy diet. But what is a brain-healthy diet? In my opinion, a brain-healthy diet should meet all three of these simple criteria. It should naturally provide adequate amounts of all essential nutrients, which means it must contain animal foods. It should exclude ingredients which damage the brain, which means it should be free of refined carbohydrates, vegetable oils, and other factory foods. And third, it should supply energy in ways that support healthy brain metabolism over the lifespan, which means it should keep blood sugar and insulin levels in a healthy range and allow the brain to spend some time in ketosis on a regular basis. So why do I say the brain needs animal foods? I say this because plant foods lack key nutrients required for healthy brain development and function. The first macronutrient we'll talk about is fat. The brain is high in fat, moderate in protein, and very low in carbohydrate. A full 20% of brain fat is a very special omega-3 fatty acid called DHA, and DHA does not exist in plant foods. DHA has a special configuration or shape that allows it to function as a semiconductor of electricity. So you find it in places in the brain and body where electricity is important, including mitochondrial membranes, where the electron transport chain is busy generating energy, synapses of the brain, where cell-to-cell communication take place. And DHA is critical to the development of the human cortex in early life. And it has been hypothesized that without DHA, consciousness and symbolic thinking, hallmarks of human intelligence, would be impossible. And while there are pathways in the body that can convert plant fats into these precious essential animal fats, they are inefficient and vary from one person to another. There is broad consensus that these conversion pathways cannot be relied upon to meet the brain's high demand for DHA during early brain development. Women who have children bear the unique responsibility for feeding the brains of future generations through their food choices. Study after study finds that new mothers who choose vegetarian and vegan diets have a hard time supplying their babies with DHA. If these much lower levels are not sufficient to support the developing human brain, irreversible damage could result. So for those choosing a vegan diet, omega-3 supplements extracted from algae are extremely important, as they are the only types of supplements that provide DHA and EPA directly. Now, what about protein? Although it's more difficult, with careful planning, you can meet your brain's protein requirements through plant foods alone. However, because the brain is an energy hog, it needs lots and lots of micronutrients, vitamins and minerals, to run the reactions that turn food into energy. And this is where, if you get most or all of your protein from plants, you may run into some serious problems, because not only do plant foods lack certain essential nutrients, but some of the nutrients they do contain come in the wrong form. So they're harder for us to absorb and or utilize. And to make matters even more complicated, many plant foods contain antinutrients that interfere with nutrient availability. An excellent example of this is phytic acid, a mineral magnet found in grains, beans, nuts, and seeds that interferes with the absorption of calcium, magnesium, iron, and zinc, all of which are very important to brain health. Iron deficiency affects 10 to 20% of women of reproductive age around the world. We think of iron deficiency as causing anemia, but what many people don't realize is that if you have iron deficiency, you don't just have a blood problem, you also have a brain problem. These minerals are critical to healthy brain development in early life. They're critical to neurotransmitter synthesis and many other aspects of brain function. This is why diets too low in animal foods and too high in grains, beans, nuts, and seeds, they create the perfect conditions for mineral deficiencies to develop. We should not think of these as normal or acceptable. The three most widespread and disabling micronutrient deficiencies in the world are iron deficiency, vitamin A deficiency, and iodine deficiency. And as you can see here in this table, animal foods are superior sources of all three of these critical nutrients, as well as several other essential nutrients. Now, there are currently no studies I'm aware of that have ever been designed to explore how eating a vegan or vegetarian diet affects people with mental illnesses. So there's no scientific support for the recommendation of these dietary patterns for the treatment or prevention of psychiatric conditions. But there have been studies of vegan and vegetarian diets that have been conducted to explore their effect on physical health. But unfortunately, all of the studies that I'm aware of to date suffer from the same serious design flaw, which is that researchers didn't simply reduce or eliminate animal foods in these experiments. They also manipulated numerous other lifestyle variables like exercise, stress, smoking, and alcohol use. And they also removed all the junk food, including the refined carbohydrates. So there's really no way to know which of these changes may have been responsible for the reported health benefits in these studies. It is intellectually dishonest and potentially dangerous from a public health standpoint to claim that meatlessness was the magic bullet. Now, despite this lack of scientific grounding, the U.S. dietary guidelines, the WHO report on meat and cancer, and the Eat Lancet report Arguably, the three most influential nutrition documents in the world all discourage the consumption of animal foods in general and red meat in particular, with the anti-meat messaging becoming stronger over time until the publication of Eat Lancet in 2019, which went to the extreme of recommending that everyone in the world aspire to virtually eliminate not just meat, but all animal foods from their diets. Now, I gave an entire presentation critiquing these documents, if you're interested in this subject, which is freely available on YouTube for those interested in learning more. But the bottom line is that the arguments used in these very influential documents are not only illogical, they're not grounded in any scientific evidence or human clinical trials. Simply removing animal foods from the diet for the purpose of improving any aspect of health remains an untested hypothesis, a grand human experiment with clear, well-documented nutritional risks and no proven benefits to date. For all of these reasons, I'm convinced that a brain-healthy diet should include nutritious animal protein and fat, and exclude anti-nutritious grains and legumes. Therefore, a so-called paleo diet of whole plant and animal foods that excludes grains and legumes is likely a superior dietary strategy for nourishing and protecting the brain, and far better reflects our evolutionary history as well. Basically, that's the diet that the brain grew up on. So we've established that the brain needs dietary protein and fat. What about carbohydrate? Doesn't the brain need sugar for energy? Well, yes, the brain does require some glucose to be available at all times, but the human body can make glucose from scratch out of fat and protein, smoothly, reliably, around the clock, without any peaks or valleys or drama. So dietary carbohydrate is optional. If you choose to include carbohydrate in your diet, it's important to choose wisely, meaning whole fruits and root vegetables, ideally, because refined carbohydrates like sugar, flour, fruit juice, and cereal products cause unnaturally steep spikes in glucose and insulin levels that can destabilize and damage the brain. Unstable glucose levels trigger the release of stress hormones like adrenaline and cortisol, which can result in palpitations, weakness, sugar cravings, anxiety, irritability in sensitive individuals. The average person consumes refined carbohydrates 3 to 6 times a day, placing themselves on this invisible internal roller coaster all day long and even well into the night. So to find out where you stand, I would encourage you to buy or borrow a simple fingerstick blood glucose meter and test your blood sugar at home about an hour after eating. Even better, if you can access one, wear a continuous glucose monitor for a couple of weeks. In Canada and in many European countries, you can buy these without a prescription. But here in the United States, continuous glucose monitors, the sensors require a prescription. A single sensor, which provides 10 to 14 days worth of data, costs about $70 here in the US. This is a screenshot of continuous glucose monitor readings from one of my patients who was eating a sugar-free Mediterranean diet. Now, the two most important signs of carbohydrate, of poor carbohydrate tolerance, are very unstable glucose levels and glucose levels that spike too high. Ideally, you want your blood glucose to stay under 125 milligrams per deciliter or 7 millimole, and any way of eating that spikes it to over 140 milligrams per deciliter or greater than 7.8 millimole is dangerous for the brain and body and should be avoided. So as you can see, this particular individual had quite a bit of variability, and glucose levels rose into the unhealthy range there, just to the right of the middle of the chart, and that was after eating an afternoon snack. That snack consisted of a small quantity of plain unsweetened yogurt topped with whole grains, 1 piece of salmon nigiri, which is just some raw salmon and white rice, and 4 mushrooms. So this Mediterranean diet was clearly not particularly healthy for this particular individual's metabolism. This tracing, the blue tracing, is what glucose tracings look like on a ketogenic diet. Much more stable, a lot less drama, and really in the healthy range the entire time. So the problem with high sugar, high insulin diets isn't just, unstable blood sugar and insulin levels and risks for type 2 diabetes and many chronic physical health conditions. High sugar and high insulin diets destabilize and damage the brain in a variety of different ways. So let's say that you were to take my advice and build include foods in your diet that build a wonderful foundation for a healthy brain, whole plant and animal foods, and you've done that all day long. You've been really excellent at doing that all day, and then you reward yourself at night for your efforts by splurging on sweets, baked goods, or sugar-sweetened beverage. And what you've done in that case is you've taken your beautiful, nice, healthy brain and dropped it into an unhealthy, hostile environment of inflammation and oxidative stress. When glucose levels are too high, that excess glucose sticks to proteins, sticks to DNA, sticks to other cellular components, and turns them into crippled molecules called advanced glycation end products. And these accumulate and interfere with normal cell function. So to cope with this problem, brain cells release signaling molecules like cytokines and oxygen-free radicals. And these are there to deliberately create inflammation. Now, temporary controlled inflammation is actually a good thing. It's the necessary first step in responding to any threat. You can think of them as ambulances that are rushing to the scene of an emergency. So we do need inflammation. But the next step after cleaning up that mess is supposed to be healing the damage and returning the system to normal. Unfortunately, however, for people who are eating high sugar foods 3, 4, 5, 6 times a day, this process never quiets down. So what you have instead of temporary, controlled, regulated inflammation, you have uncontrolled chronic inflammation and oxidative stress. Now, inflammation and oxidative stress can cause significant imbalances in neurotransmitter levels, including serotonin, melatonin, dopamine, GABA, and glutamate. Levels of glutamate in particular can increase by up to 100 times their usual levels. Now, glutamate is the brain's primary excitatory neurotransmitter. You can think of it as the brain's gas pedal. And unfortunately, sustained high glutamate levels are toxic. Excess glutamate directly damages proteins, lipids, nucleic acids like DNA and RNA, and mitochondria. The blood-brain barrier that protects the brain from risky substances can be compromised too. And the cells of the hippocampus, our brain's learning and memory center, can begin to die off, causing the hippocampus to shrink. Now, high insulin diets can also restrict the brain's access to energy because chronic overexposure to insulin can cause insulin resistance at the blood-brain barrier. Now, no matter how insulin resistant you might be, glucose, sugar, blood sugar can still waltz into the brain, no questions asked. So the higher the blood sugar, the higher the brain sugar, even in people with severe insulin resistance and type 2 diabetes. Even those people do not need to worry about low brain glucose. What people with insulin resistance need to worry about is low brain insulin, because insulin resistance makes it increasingly difficult for insulin to cross into the brain. So paradoxically, over time, The higher the blood insulin, the lower the brain insulin. And this is a huge problem because brain cells can't process glucose and turn it into energy without adequate insulin. So in people with insulin resistance, the brain can literally be swimming in a sea of glucose and still be starving to death. Now, that dire predicament is called cerebral glucose hypometabolism, sluggish brain glucose processing. This fundamental energy crisis is the driving force behind most cases of late onset Alzheimer's disease. We now know that Alzheimer's disease is preceded by decades of gradually slowing glucose processing in the brain. Studies consistently show that the more insulin resistant you are, the slower your brain glucose processing will be. Now, we know very little about how this increasingly common problem influences conditions other than Alzheimer's disease, but it stands to reason that a shortage of brain energy could cause all kinds of problems for mood, behavior, and cognition. And in fact, imaging studies do find evidence of brain glucose processing problems in depression, bipolar disorder, and schizophrenia. Now, the bad news is that this combination of high brain glucose and low brain insulin is a deadly 1-2 punch for brain health. And together, these two phenomena can result in all of the root cause mechanisms of psychiatric disorders that you see listed on this slide, and many more. The good news is that the ketogenic diet naturally helps with all of these mechanisms listed on this slide. So what is the ketogenic diet? There's a lot of confusion about this question out there. So my definition is any way of eating that lowers insulin levels enough to turn on fat burning and generate physiologically meaningful levels of ketones in the blood. It is very important to understand that not all low carbohydrate diets are ketogenic. Most low carb diets will reliably lower and stabilize blood glucose and therefore stabilize brain glucose as well, but they don't always lower insulin levels enough to allow ketones to rise into the therapeutic range. This is because carbohydrate is not the only thing that stimulates an insulin response. Sweeteners, whey protein powder, powdered ingredients, and even simply overeating can all keep insulin levels high enough to prevent ketosis. However, lowering and stabilizing blood sugar is still a major health achievement, and it does help some people with mental health symptoms, especially people with simpler concerns such as anxiety or brain fog. But in my clinical experience, being in ketosis helps a lot more people, particularly those with more severe psychiatric symptoms or with more severe or longer standing metabolic damage, insulin resistance, type 2 diabetes, etc. So what do the studies say so far about ketogenic diets and mental health? A formal study of ketogenic diets in the treatment of mental health conditions specifically is in its infancy. However, in just the past few years, academic papers from around the world exploring the scientific mechanisms behind how ketogenic diets might work to improve psychiatric conditions such as bipolar disorder, depression, autism spectrum disorders, anxiety, and psychosis have begun to appear in the scientific literature. And these lay the theoretical groundwork for more research. But we do already have a handful of case reports and very small pilot studies to inspire us. There's a single paper about 2 women with bipolar disorder type 2 who found the ketogenic diet to be superior to the mood-stabilizing medicine lamotrigine. There are 2 case reports and 3 small but promising studies suggesting that ketogenic diets can be helpful in reducing symptoms of autism spectrum conditions in children. There are 4 papers describing people with schizophrenia improving on ketogenic diets. In 2 of these cases, the result was long-term symptom control and complete discontinuation of antipsychotic medications. There's one paper describing 3 individuals with binge eating disorder and food addiction whose symptoms responded beautifully to a diet restricted to a maximum of 30 grams of carbohydrate per day, bringing binge episodes down from once or twice a day to essentially 0 episodes per week. And they were able to maintain those improvements even 6 months later. And there's a handful of case reports and small pilot studies showing glimmers of hope in people with mild cognitive impairment and even early Alzheimer's disease. So, do we need more studies? Yes, more studies would be wonderful. They would help convince the skeptical and usher these treatments into mainstream practice. And more rigorous research is already underway by Dr. Adrian Soto in Mexico, by Dr. Shabani Sethi-Dalai at Stanford University, and Dr. Anu Rusunen in Finland. But it has been known for a century already that ketogenic diets have the power to stop epileptic seizures in their tracks. And if that isn't proof that ketogenic diets have the power to stabilize brain chemistry, I really don't know what would be. In addition to the 100 years of clinical and research experience with ketogenic diets in epilepsy, there's emerging evidence for the use of ketogenic diets in other neurological conditions as well, as you can see on the slide. The brain is not divided into neurology cells and psychiatry cells. It's one organ. So it stands to reason that an intervention that has been shown to be safe and effective in the treatment of neurological conditions would also be prudent to apply to the treatment of psychiatric conditions. And in my opinion, the science is already here. It's just the clinical trials of psychiatric disorders, specific psychiatric conditions that need to catch up. So, currently, a standard psychiatric evaluation consists mainly of a psychosocial history, symptom checklists, and a medication recommendation. It's time for this to change. I firmly believe that a modern psychiatric evaluation should include a search for signs, symptoms, and biomarkers of potentially treatable root causes of psychiatric symptoms, including tests for nutrient deficiencies, inflammation, and very importantly, a metabolic evaluation to assess for insulin resistance. Everybody with mental health concerns deserves a metabolic evaluation because if metabolic dysfunction exists, which is now the case for the majority of adults, the brain will not be able to access the energy it needs to function at its best. So lots of arguments for considering ketogenic diets in the treatment of psychiatric conditions, but is it safe? The safety of ketogenic diets for the treatment of physical health conditions such as type 2 diabetes and obesity is well established now. But is the ketogenic diet safe to use specifically in the treatment of psychiatric conditions? Now, before I answer this question, I wish more people would ask this question about the diets recommended by the USDA, the WHO, and Eat Lancet, which should come with a skull and crossbones on them. But I digress. The ketogenic diet is a powerful metabolic intervention that has rapid and profound effects on brain and body chemistry within only a few days. These are healthy changes, but the safety question is so nuanced and important that I devote at least an hour of my training program to this topic. But for the purpose of this presentation, and in the interest of time, let me just say this. Ketogenic diets are safe for most adults, provided that they are properly constructed and provided that medications and medical conditions are carefully monitored, particularly during the early adaptation phase. However, there are some people who should not attempt a ketogenic diet, including, for example, those suffering with active symptoms of anorexia. And there can be special clinical challenges involved in helping people with psychiatric conditions transition to a ketogenic diet, including how to manage temporary worsening of symptoms in some cases, and the need to adjust dosages of psychiatric medications. There are also special considerations for pregnant and nursing women, as well as people with certain health conditions. So using it in clinical practice does require some special knowledge and skill. Now, for most people, the ketogenic diet is a much healthier intervention than conventional medication-only treatments. Psychiatric medications in general and antidepressants in particular have a rather disappointing track record of bringing people a substantial relief from their symptoms. And the relief that some do experience all too often comes at the expense of significant side effects that can take a serious toll on quality of life, including weight gain, apathy, fatigue, and sexual side effects. So what I love most about prescribing ketogenic diets in my work is that instead of spending half of my time warning about medication side effects and managing those medication side effects, we get to look forward to side benefits. Instead of high blood pressure, higher blood sugar, higher triglycerides, higher appetite, we can see in most cases lower blood pressure, lower blood sugar, lower triglycerides, and better appetite control. Instead of brain fog, and you can see mental clarity. Instead of sedation, you can see increased energy, etc. So, using nutritional and metabolic strategies in my work has completely changed the way I feel about practicing psychiatry. And it completely changes the way my patients feel about their symptoms. Maybe it's not genetic. Maybe it's not all about their childhood. Maybe it's not a character flaw. Maybe at least in part, their suffering has a biological and potentially reversible cause. Ketogenic diets have been shown in scientific studies to address many common biochemical features of psychiatric conditions. They reduce inflammation and oxidative stress. They support the growth and maintenance of new brain connections, so-called neuroplasticity. They help stabilize neurotransmitter and hormonal systems, and they provide a safe, clean source of fuel that burns beautifully, even in the insulin-resistant brain. It's true, we do not have enough clinical research yet to tell any given patient how likely it is that a paleo or ketogenic diet is likely to help them with their particular diagnosis. So what I tell my patients is this, we don't know what's possible for you unless we try. So with that in mind, let's summarize a few key points. If you yourself are struggling with mental health issues, a paleo diet is an excellent and universally safe starting point for any human interested in improving brain and total body health. It doesn't require any special medical monitoring, even if you're taking medications. However, if you have insulin resistance, a paleo diet may contain too much carbohydrate from fruits and starchy vegetables to bring glucose and insulin levels into a healthy range, which is where low carbohydrate diets can be so helpful. A ketogenic diet is also usually the next logical step if a paleo diet doesn't help or doesn't help enough with your mood or concentration issues. If you're considering embarking on a ketogenic diet, it's very important to learn more, to consult with a keto-savvy clinician first, especially if you have any health problems, have serious psychiatric symptoms, or take medications of any kind. There's more information on my website, Diagnosis Diet, and in a guide I wrote to low carbohydrate diets and mental health that I wrote in collaboration with the team at Diet Doctor on their excellent website as well, dietdoctor.com. Now, if you're hoping that dietary changes can reduce or replace your psychiatric medicines, please note that it is very important never to stop any psychiatric medication abruptly or without medical supervision, as this can cause very unpleasant and in some cases even dangerous withdrawal effects. So, but I do think that this is a strategy well worth considering. So if you're waiting If you're waiting as a clinician or as a person struggling with mental health symptoms yourself, if you're waiting for large randomized controlled trials testing ketogenic diets in the treatment of every mental health diagnosis we face, you will be waiting a very long time indeed. So in the meantime, why not consider becoming an early adopter of the science of hope and see what's possible for you? So thank you very much for your attention. I look forward to your questions and comments during the live Q&A session this weekend.
Well, as you say, Paul, great speaker, fascinating topic. I think this is one of the really exciting areas of low carb, mental health, neurological conditions. I think that's going to be the big area of the future. And I think, they've shown, a number of studies now have shown that, a low carb approach is just as effective, if not more effective, than antidepressant medication and other weapons that we have at the moment. So I think it's a really exciting area, and hopefully there'll be some more research done in the next couple of years.
Well, I'm seeing more and more patients in clinic who are having very, very impressive gains and improvements in their mental health with just dietary change, and they'll often attend for more, I guess, traditional metabolic reasons such as diabetes, high blood sugar, weight, things like that. And the mental health benefits often come as a complete surprise, but they're often much, much more appreciated. And I mean, well, just recently you told me about a story, a bit of an off-chance encounter you had where you actually came across somebody who had improved significantly in terms of mental health.
Yeah, well, that's right. I forgot about that. But fascinating. I was in the coffee queue at university a while ago, and a young lady came up to me and said, "Professor Brookner," and I said, "Yeah." And she said, "Oh, I enjoyed your lecture the other day." And I said, "Oh, it's nice. People don't usually say that to me." And but she said, "But that's not what I want to talk to you about." And I thought, "Oh, it's interesting. What's coming here?" And she said, "My husband and I are massive cricket fans, and because of your involvement in cricket and you're promoting a low carb diet, we decided we'd try the low carb diet, and we've been doing that for the last 12 months." I said, "Oh, great." She said, "My husband's been bipolar all his life, and he's now off all his medication, and he feels terrific. And I just want to thank you for changing our lives." And I thought, "Oh boy, that was I didn't expect that." And that's the sort of effect that it can have. I mean, it's so dramatic. I mean, this guy had been on all sorts of medications and really didn't have his bipolar under control at all. And simply by changing his diet, he completely changed his long-standing mental health issues. So that just blew me away. And it's there's a story we're starting to hear more and more often. It's not just bipolar, but obviously depression, anxiety, different, and plus neurological issues as well. So yeah, it's there's something going on there, and we're going to hear a lot more about that in the future, I think.